My comments are a summary of my written testimony. My name is Eduardo Sanchez. I am a father of 4. I've practiced medicine in a federally qualified health center. I directed the Texas Department of Health and Texas Department of State Health Services over a 4-year span. And now I'm the Chief Medical Officer for Blue Cross Blue Shield of Texas, a division of Healthcare Service Corporation, non-investor-owned health insurance company that operates plans in Texas, Illinois, New Mexico, and Oklahoma. Healthy children are key for national security, economic competitiveness, and to bring down the cost of medical care in our nation. The prescription for a healthy America is healthy eating and moving more. The Improving Nutrition for America's Children Act is a vital part of getting the prescription right. There are roughly 10 million obese children and adolescents aged 5 to 19 in the United States. That's more children than there are people in 40 of the states in the United States. It's 20 million children and adolescents if we include overweight and obesity, and the poor and some racial ethnic groups have higher rates of obesity than others. Most of these children attend public school. This bill will make it possible for more children in school to have access to the healthiest food options possible. The economic impact of childhood obesity is unreal and cannot be understated. Obese children are more likely to become obese adults. Obese adults are more likely to have a whole host of other medical conditions. Nationally, obesity-related medical costs are nearly 10% of all annual spending and are estimated, or were estimated, to be $147 billion in 2009. The aggregated cost of obesity in the United States over the next 10 years will approach, if not exceed, $2 trillion. In Texas, we estimated the cost of adult obesity in 2005 at $10 billion. That's roughly $500 per Texan per year, and projected that the cost would be approximately $40 billion by the year 2040, 4 times the cost, but only 2 times the population. The bill we're talking about today is estimated to cost about $8 billion over 10 years. That's less than 1/10 the price of obesity in just the state of Texas over the same 10 years. Arkansas has looked at the cost impact of obesity in its Medicaid and S-CHIP programs and sees higher rates of illness, more doctor visits, and higher costs as early as 10 to 14 years old. In fact, 8% higher costs, and among 15 to 19-year-olds, 29% higher costs. The annual cost of childhood obesity in the United States is just over $14.3 billion. But with 4,000 children and adolescents who are diagnosed with type 2 diabetes annually, that's something we used to call adult-onset diabetes, now occurring in children, these costs will grow. I've painted a bleak picture, and you have a unique opportunity to make a difference. In communities across the country, we are seeing the positive results of comprehensive efforts to improve the health of children with nutritious food and physical activity. But these are isolated success stories that can only be repeated with passage of this bill. Schools provide a natural setting to promote healthy habits, but research shows that schools aren't as healthy an environment as they can be. Children spend a lot of time in school and eat 30 to 50% of their calories there on school days. In medicine, we sometimes talk about lost opportunities. When a child or an adult is in the office, for example, is due for a screening test or vaccine, but leaves without that test or vaccination, not providing children healthy food is a lost opportunity. The Improving Nutrition for America's Children Act is a strong bill that includes a number of important provisions to help shift the balance and make it easier for children to make healthy choices at school. H.R. 5504 will improve meal quality, update nutrition standards for all school foods and beverages at school, strengthen local wellness policies, and provide needed resources for training, technical assistance, and nutritional education. It increases the reimbursement rate for lunches by 6 cents. The bill also includes a number of provisions to increase access and make it easier for kids to participate in child nutrition programs throughout the year, not just during the school day. This is a smart bill that can realize a fairly quick return on investment. I urge you to work with your colleagues in the House to secure funding and pass this bill soon, as time is running out and our children deserve our attention. The health of America's children depends on a prescription for healthy food and more physical activity. This bill will improve the quality and healthfulness of food in America's schools, improve the health of America's children, reverse the childhood obesity epidemic, reduce the burden of diabetes, heart, and other chronic diseases, and therefore demand for very expensive medical care, and finally, improve the readiness, willingness, and ability of our future civilian and military workforce to compete for jobs and defend our nation. I thank you for your time, and I thank you for your interest.